Lydia Skirtis, and I have been with Dr. Gorgas for 4 months now. And it's unbelievable the transformation that I have been through. I had been depressed and anxious for 3 years. I lost my husband 4 years ago, and he had cancer for the last 11 years of his life. And so it wasn't easy. I also lost my mother and my aunt and several dogs, and my life, you know, when I got depressed, it seemed like it was a natural place to be. But then when the depression didn't go away, I really got worried, and I changed psychiatrist, and you know, so the second psychiatrist I went to, he sent me to Scripps Mercy Hospital to do what they call ECT, which is electric convulsive therapy. So I went and I had 14 of those.
That's kind of like shock therapy, isn't it?
Shock therapy.
My goodness,
yes.
What a cool name.
Yeah. I would go in and they would anesthetize me completely. So there was an anesthesiologist and a doctor performing this. And it was over in an hour. It was a very short thing, but you know, I couldn't drive during that period. I was shaking all over. I had no balance. I was a mess. I was a mess because I was still depressed. I was still anxious. I was having night sweats. I would wake up at 2 o'clock in the morning, and you know, all my hair would get wet, like I had been coming out of the shower. My pajamas were attached to my body from the wetness, and I wasn't functioning. I didn't have any appetite. I lost 20 pounds.
My goodness. In
the process. And I was a mess. I was very, very anxious, very depressed, and I had never been like that in my whole life. And it was such a hard thing to take because, you know, I wasn't like that. I was always the one that would pick up and go, and so I never knew what depression was and what anxiety was. And so I decided to, you know, go the alternative way. And
is that how you found our office?
Yes, I Googled, you know, thyroid, because I always had the idea that it was something in my thyroid, even though it had been checked 4 times during these 3 years, and every single time it was normal. There's nothing wrong with your thyroid, you're normal, you know, and here came the antidepressants. You know, I took every single antidepressant you can imagine, and none of them worked. You know, it was like, okay, so I'll switch to this, and I would hope and pray that that would work. Nothing worked. So that's how I ended up with Dr. Gorgas, which I am infinitely.
So we're 4 months into the process right now. We've treated you neurologically.
Yes.
Because we found that you had some head trauma earlier in life.
Yes, I did.
And we were giving you specific adjustments to the upper cervical spine.
Yes.
And what happened in the first 30 days? Remember, I told you that you'd see a difference in the first 30 days, and you kind of like looked at me like, really?
Yeah, there was. I mean, it was fast. I mean, I became normal within my own mind very quickly, you know, and I couldn't believe it. I mean, I would wake up in the morning and I would wait to be depressed, and I wasn't. I would go to bed at night and say, oh, okay, now I'm going to sleep a little bit and have terrible nightmares, and I didn't. So, you know, I just got better and better and better. My appetite came back. I can sleep normally now. So it's been a
And how's your focus and your energy levels?
My energy level is back to where it was. I've always been a very energetic person. I've always exercised. I walk. You know, I'm back to myself.
Were the program with the supplements, was that something new for you in doing all the blood?
I had never done supplements, and you know.
And how do you feel about the diet changes and the supplements that I
The
recommended?
diet changes have also helped. The fact that I eat every 2 hours completely, I can feel that that's the way I should eat, and no gluten, and you know. It has been not hard at all.